and would now like to hand over to Rachel Dunscombe, who's the Chief Exec for the Digital NHS Digital Academy. Previously, Rachel was CIO at Salford, and also to Aasha Cowey, the Programme Manager at NHS South Central and West. So could I hand over to you, Rachel and Aasha, and if you can share some of your thoughts in this vibrant area as well, that would be super.
Absolutely, thank you. Aasha, are you out there?
I'm here, hello.
Oh, hello. Really good to talk to you, because you are one of the most exciting people in workforce development at the moment, in my view. So can you tell us a little bit about the work that you're doing and what you've learned from reviewing and analysing the landscape out there? Because I know that you're doing an awful lot of work around the gaps and the signposting and the opportunities and the talent pipeline. So can you tell people a little bit about what you're doing? Because you've been a superhero on this stuff.
Thanks, Rachel. Yeah, absolutely. And you know, it's been great to get to know and work with people like you as part of this. And you know, there's so much excitement out there and so many people out there who are really enthused about all of this agenda. So just for people who don't know me, I'm a programme manager at South Central and West CSU. But my majority of the work at the moment is spent working with Health Education England and the Digital Readiness Programme. And a big part of that has been looking at the expansion of the NHS Digital Academy for something which is, you know, a brilliant but quite oversubscribed and specific offering to something which meets the needs of a much wider range of individuals, and it has a lot more access. So a lot of the work I'm doing at the moment is at the intersect of where workforce meets digital transformation, change leadership, EDI, all of that. So it's a really exciting place to be. So one of the things you mentioned was about the landscape, and it's been fascinating. So this work started back in March, April, and one of the first things we did was we started to map the landscape and have a look at what's already out there. And the work highlighted that we've got some really significant gaps actually when it comes to supporting and developing our workforce. So the Digital Academy itself, so that currently consists of the postgraduate diploma in digital healthcare leadership, which obviously you've been instrumental part of delivering, and it's been fantastic. But it is aimed at a very senior audience, so it is largely aimed at those working in a sort of CIO, CCIO or equivalent role. Or those, you know, really at the forefront of leading digital change within their organisations. We've also got quite a few entry-level type schemes and programmes. So we've got the NHS Digital Data and Tech Graduate Scheme, led by the Health Innovation Network, and there's also the National Graduate Management Training Scheme, and they offer specialisms in informatics, but also health analysis more recently. And what was really evident to me was there was this massive gap in the middle. And this gap is really important because actually that's our next generation of senior leadership. And if there's nothing to sort of support them or for them to go, then how do we support them? And why is that important here, I think, is actually we talk a lot about diversity in really senior roles. And, you know, we know that we haven't got great diversity in our senior roles in digital. You know, that's why the Cowey network are here in part. But we can't magic people into those roles from nowhere. So it's really important that that pipeline, you know, we support that whole pipeline and we support that diverse talent pool to grow. And you know, I'm sort of in that middle management area, and it's not uncommon for me to step into a room and be the most senior person who's a woman of colour, or even a woman or a person of colour, you know, so we have to get better at that. So for me, I think there's so much good stuff out there, but you know, it's this bit in the middle we have to get right. We have to get this talent pool sorted, and we have to sort of give more people opportunities really in that space. What are your reflections on this? Because obviously you've done loads of work in this area.
Yeah, so it's fascinating for, you know, obviously as you said, I've been leading the academy, and as you said, we have to pipeline people in at the right pace and make sure that we are, you know, taking people's careers on and up. And so we've been increasing diversity year on year. But I guess for me, this is like the birth of a professional professions, yeah. And I've got a lot of friends who are in nursing, and I remember back in 2000 when they started the nursing profession, you know, they went into sort of formal degrees and things like that. Now we see, you know, you can do prescribing and masters, and I even know PhDs in nursing. But that whole journey, it took a lot of infrastructure, and it took a lot of supporting the right talent along that pipeline and creating the infrastructure for that. And for me, what I can see is that you're creating the equivalent of what nursing had back in, you know, around about 2000 when they sort of professionalized. So my reflection is it's a journey, and there's lots of pieces you've got to put together. I'm really, really proud that we're increasing the breadth and depth of our talent. Yeah. And that is absolutely amazing for me because, you know, it's interesting. Victor just said a little bit about, you know, the lack of diversity within healthcare, but certainly when I remember going into tech and healthcare, it was very monolithic. And, you know, everything we learn about co-design is, you know, that wonderful, you know, perspective that we get from everyone being around the table. So be it your professional background, you know, it's great that we've got therapists and nurses and dentists and, you know, all of those people around the table in terms of the digital health skills now. Be it north-south divide, be it whatever, we just need this equity across the country. And you know, that runs through to all the educational work that you're doing, which I think is really exciting, to make sure that we have the university places, the apprenticeships, and all of those things right across the country that is open to all of our talent. So, yeah. So how do you think the expansion of the academy is going to support inclusion going forwards? Tell me a little bit about your thoughts on that.
So that was really interesting, and I think you're right. We're absolutely on a journey, and I know. So I'm really invested in this because actually this impacts on my future as well potentially. And you know, it's not been uncommon for me to actually feel a bit overwhelmed with some of this work because you know, it's important for my future, and it's something that might genuinely help others out there. And you know, it is in its infancy, but it's brilliant to see how much progress has been made if you step back and look at even the last 5 years of where this is all going. So that's really exciting. So yeah, it's good to remind me that it is a journey, and to, you know, sort of stay in perspective sometimes, I think. I think there's some really exciting stuff going on at the moment in the diversity and inclusion space for the expansion of the Digital Academy, and I think there's probably two ways that I'd look at it. And before I start that, I think diversity in this space can sort of be, I think you can look at it as, you know, protected characteristics, so you know, your traditional sort of sense, but also diversity in different professional backgrounds. So you know, how do we make sure opportunities are sort of more fairly spread out to those groups, and we don't have certain professional groups that are, you know, are left behind or don't have those same opportunities. So I think when I talk about diversity and inclusion for this piece, it's very much for both of those perspectives. So yeah, I think there's probably two ways to look at it. I think the first is to make sure the opportunities are accessible. So this could be delivering things in a slightly different way. So my personal experience is I've got a 3-year-old, and I personally probably struggle to do the current offerings, just because I would struggle with residentials. You know, to be completely honest, I'd struggle to be away from home. That's my personal need. You know, some people won't have that. Some people have different needs, and I know, you know, just through conversations with you, Rachel, and the team, I know that you've worked really hard to sort of support people with their individual needs as they've needed it. But I think going forwards, I'd love us to be clearer about how we can, you know, be more upfront about people who might have concerns, and actually, you know, invite them to have a conversation to say, actually, if you're concerned about how this might fit in with your personal needs and your personal requirements, you know, let's talk about it first, rather than that, you know, potentially being a barrier to stop them applying in the first place. And in line with that is obviously making sure anything we produce, any of the virtual stuff we might produce going forwards, you know, meets accessibility standards and all that sort of thing, so we're not excluding people. And then the second thing is, I think, is to make sure that for any of the programmes that we do, especially those that have got limited spaces, is that we have a really good inclusive recruitment process. And actually, you know, a lot of the issues don't start from interview or shortlisting, as you know was mentioned just on sort of Victor's presentation just now, it's often the application process as well, and making sure people even get to that stage, or they're aware of it and they have the confidence to do that. So you know, I'm really keen that we have a look at how do we make sure that underrepresented groups have more confidence in applying, how can they see people that look like them. And I know Shuri Network did some sessions previously to support, you know, people who are interested in applying for the Digital Academy. And then when it comes to the shortlisting, you know, how do we remove bias and be a bit more transparent about the process. And I think one of the things we've just kicked off is a project to make sure that we develop an inclusive recruitment process for future cohorts, and we're looking to the regional talent boards to sort of share the learning that they've already done from their processes. So really exciting, and you know, I'm really keen that EDI has a much more focal point within any content we produce, and maybe also doing some specific EDI educational modules, because I think that'll be really key. And I think just to finish, you know, conversation we've had before, Rachel, you know, we've been in the room often where we've been the only two women in the room talking about a lot of this stuff. So I'm really keen to make sure that, you know, from a governance perspective, the decision making has more voices heard. So that's something that I'm really keen to sort of get a grip on.
Yeah, I love it. So for me, from my background, you know, I worked with the Prince's Trust to bring in people who had, you know, counter narratives to my organisations. I work with sixth forms, you know, in particular with women within the Manchester region, to encourage them to come into digital health. And this whole piece for me, it starts very early. A lot of it is about the pipelining, and even going into sixth forms still, you know, with my kids, you still see a skewed narrative around women going into tech, or you know, what you would look like if you were going to go into tech. And I love the fact that you and other people are standing up and creating this newer narrative, because it takes a lot of us to actually get that diverse talent in. And one of the things I really like that you've done is just role modeling, because it's been like, I've had a few people say, if Aasha can do it. And I think that is just amazing. So it's not just doing what you do, but it's being seen to do it. And I'm just giving you huge kudos for that, because we've all struggled, I think, on this journey, haven't we? You just talked about, you know, it being difficult accessing. There are certain educational opportunities I haven't been able to take in the past as a carer and a parent, you know. And what we have to do is make these things super inclusive. You know, in the academy, we talk to people who've had long-term carer responsibilities, you know, children, complex situations, healthcare needs of their own. And why should that preclude you from being the best you know? And I totally take on board what you're saying, definitely.
And sort of thinking about your experience, you know, as a very experienced CIO, what action have you taken in the past to sort of develop that more diverse workplace? And is there any learning that I could take from that for the work we do going forwards?
And that's a really interesting piece. And I guess, you know, I, to a degree, am counter narrative. So I'm from Liverpool, and I've come from a pretty diverse background. And I also came from a family, luckily, where I had women that worked in tech, even in the 70s. And, you know, so for me, I thank my parents, not anybody else, my parents, my aunties, and all those people that were counter narrative, because for me, it felt intuitive that everyone should have an equal right to be in this profession. And when you looked around, you know, you kind of think, it was very white and male, yeah, when I arrived. And that, for me, I was just trying to find a more balanced environment, because, you know, what ideally for me is that we represent our local populations. You know, what I loved about, say, Salford was that we were very Salford based. We had a lot of people from Manchester who used to work there. And so I very proactively, I've done this a few times. I've spotted people who've worked in a completely different field, and I've gone, you look like you could really help us in this, you know, digital health. And it could be somebody that's a therapist or a nurse or a podiatrist or you know, somebody that worked in medical records, and just trying to bring in people that I felt had talent. And, you know, some of those people came from very different environments. But I would say that the results of a very diverse environment is a far better output. It really, really is. And it's a far nicer office to go into as well. And, you know, I'm really fond of the Salford and the Bolton environments that I worked in, because it was truly diverse. And, increasing numbers of women. I also work very actively to get female apprenticeships in, and some of them are doing really, really well, which you just feel really good about that, right? Because it's lovely to see people thriving. So I kind of saw it as my job. And I also work for Raj Jain, and Raj Jain said to me, border on positive discrimination if you need to. And I often dwelt on that, and I'm like, what does that mean? But what it means is if you spot talent, right, bring it in, a diverse talent. And he was one of the most amazing leaders that taught me so much about creating that diverse environment, and he has done that at Salford, and it's all the better for it, I think. So I thank all those good people around me that you know, showed me it was the right thing to do. I've had lots of really great people around me that have celebrated diversity. So yeah, I'm wondering if you can tell me a little bit actually about the workforce planning, and yeah, how do we start this workforce planning piece? How do we equal out some of these inequities we've got? Because it takes a number of people. So what are your thoughts on that?
It's really interesting, and I think we're at a place where, you know, I don't think anyone in this room, virtual room, where's our virtual fireplace? I've just realised that
we got one.
So I think I think we'd all agree that, you know, diversity is an issue. You know, we need to get better at it. We need more diverse groups, you know, across the whole talent pipeline, in sort of digital data informatics, whatever you want to call it. And I think one of the problems is we can't always measure that. And at the moment, we don't have sort of clear career pathways, and we don't have a taxonomy that we all buy into and we all agree to. And it's really challenging. And if I was to sort of think about the journey I've been on in the last 12 months, you know, I did this massive piece of work last year around career pathways, and it was really helpful. And one of the things I really realised was, actually, for some people, not having a career pathway, it doesn't matter, because they might have the confidence to sort of try new things and jump around, and you know, that they're happy sort of doing that, see where it takes them. And other people need structure. So it's, how do we sort of give people a bit of structure, a bit of a framework, but not dictate to them, this is what you must do, but this is what you could do, and these are the things that you might want, you know, you might be interested in. So we've got some work as part of the digital readiness program, starting off some of that workforce planning to understand, you know, how do we start to measure that, and what does that look like? And some of that will help with succession planning for the future. Some of that will help us to look at, so actually, what are the different groups and what might their training needs be? And some of it might, you know, help us to understand, actually, you know, are there specific areas that we need to target within the NHS where, you know, we need to increase the diversity more than others? And then are there specific initiatives we can do to support that? So, you know, I think we all agree there's a problem, but it might help us to sort of home in a bit on some of those sort of specific skill needs for the different underrepresented groups. And it's really exciting, and you know, I think you'll agree, one of the things is it's to differentiate sort of the career pathway from the skill bit, and they're two very different things. And it's, you know, how do we articulate that in a way which allows people to be flexible, yet gives them the chance to understand where they might want to go. Have you got any thoughts on that? And also sort of, you know, how do we not lose people's skills and retain them?
Yeah, so one thing for me is not to over codify the future career pathways. Yeah, and I think that's one of the things that we found, you know, with this digital sort of space, that there's been no signposting of how you go into it. I often say it's for the brave or the stupid, and I'm probably in the stupid category, but there is no signposting, and many people have come to me and said, how do you get there? And while you need to create that signposting, you also need to create the freedom for people to grow, right? And to diversify, you know, as they go through their career. And I think those futures, you know, there's a lot of talk about the future of work and how that's going to be change and be flexible. And I think we need to build that in for people, and we need to build in that equity piece around being able to have a life outside of work, you know, caring responsibilities, parenting, parents, you know, other commitments. So for me, it's about building in flexibility to that, but both in terms of making it feel comfortable enough that there's a career to go into, but also that there's options for you to pursue. But I'm going to ask you one question back now, final question, okay? So can you tell me in one sentence, why is professionalism important to us in digital health?
Oh,
Put you on the spot.
So I think it's important for some of the reasons we just listed. So I think, you know, we need to give people the space and the tools and the opportunities to progress in their careers. And I think, you know, one of the issues around diversity or lack of diversity can sometimes be that tap on the shoulder. So if we can, you know, make more people aware of what they could do and what they might want to do, I'd like to think that would help with some of that. And then I also think, if I think about the NHS People Plan, it's also about making sure the professionalism agenda, we don't want it to be a hindrance or a constraint, yet we want it to give people the tools and also allow them to be authentic and be true to their own values. And I think, you know, Rachel, back at you, you know, you've been a brilliant role model. So I think, you know, if we can get that balance right between professionalism but being authentic, I think that'll be really powerful. And I think we've got a way to go, but it feels like we're getting there.
Absolutely, I like that.
And so I'm going to at you.
Back at me. Okay, so I'm going to try and be really succinct. So why is it important? I think it's important because this is a profession that's going to make the biggest difference to quality and care in our lifetime, and so we need to be taken seriously as a profession. So yeah, that's why it's really important to me, and thank you to everybody for listening, because Aasha and I are both incredibly passionate about this.
Sure are. Thank you so much, Rachel and Aasha. That was delightful, and a quick thank you for all your support, ongoing support with the One Health Tech Network as well. You know, it really is fabulous, and I think, you know, what came across with you both was just this authenticity. And yes, of course, we need to be professional, but we need to be authentic. We need to be honest about where we came from, what we want to do, but just be kind, be nice to everybody, and, you know, help each other out along the way. And I've worked in a few sectors, but this is by far the most exciting, passionate sector I've ever worked in, with the most loveliest people. So yeah, I think that authenticity piece is really, really important. And of course, yeah, the digital space moves at such pace and has done certainly over the last 6 months, then it's really difficult to say, well, I'm good, this is going to be my career path, when who knows what's going to come flying at you. But thank you again, ladies, that was really superb.